My journey exploring the health implications of various protein sources began during my medical residency, when patients frequently asked about optimal dietary choices. Pork, being one of the world's most consumed meats, consistently generated the most questions and misconceptions. After years studying nutritional research and counseling patients about balanced diets, I've gathered evidence-based insights about pork consumption that might surprise you. Let's separate fact from fiction with a balanced perspective. Pork contains an impressive nutritional profile that many people overlook. A 3-ounce serving of lean pork provides approximately 22 grams of complete protein, along with significant amounts of thiamine, niacin, riboflavin, vitamin B6, phosphorus, zinc, and selenium, nutrients essential for energy production and immune function. What many don't realize is that modern pork is substantially leaner than it was decades ago. According to research from the United States Department of Agriculture, today's pork contains approximately 16% less fat and 27% less saturated fat than it did in the 1990s due to improved breeding and feeding practices. One legitimate concern involves foodborne illness if pork isn't properly handled or cooked. Raw or undercooked pork may contain parasites like Trichinella spiralis or bacteria such as Salmonella. However, the Centers for Disease Control reports that trichinosis has become extremely rare in developed countries due to improved farming practices and food safety regulations. Cooking pork to an internal temperature of 145 deg, 63 deg, followed by a 3-minute rest period, eliminates potential pathogens while maintaining juiciness and flavor. This science-based recommendation from the Food Safety and Inspection Service replaced the outdated standard of cooking pork to 160 deg, which often resulted in overly dry meat. Consumers should be aware that processed pork products like bacon, sausage, and ham typically contain sodium nitrate preservatives. Research published in the Journal of the American Medical Association suggests that regular consumption of processed meats may be associated with increased risk of certain health conditions. However, it's important to distinguish between processed pork products and fresh cuts like tenderloin, which nutrition research from Harvard School of Public Health indicates can be part of a balanced diet when consumed in moderation alongside plenty of vegetables, fruits, and whole grains. The Mayo Clinic notes that lean pork can be comparable to chicken breast in its nutritional profile when you select cuts like tenderloin or loin chops and trim visible fat. This perspective provides a more nuanced understanding than simply categorizing all pork products together. My clinical experience has shown that quality and sourcing significantly impact pork's health profile. Pasture-raised pork typically contains higher levels of beneficial omega-3 fatty acids and fewer inflammatory compounds compared to conventionally raised options. Cooking methods substantially influence pork's health impact. Research from the American Institute for Cancer Research suggests that high-temperature cooking methods like grilling and frying may produce potentially harmful compounds called heterocyclic amines. Gentler cooking methods like roasting, braising, or using a slow cooker may present fewer concerns. Portion control remains essential when including pork in your diet. Nutritional guidelines from organizations like the American Heart Association recommend limiting total meat consumption to approximately 5 to 6 ounces daily as part of a balanced eating pattern. Individuals with specific health conditions like gout may need to moderate their pork intake due to its moderate purine content. Research published in the New England Journal of Medicine indicates that purines can trigger gout flares in susceptible individuals. What surprised many of my patients was learning about pork's impressive micronutrient profile. Pork is one of the best food sources of thiamine, vitamin B1, providing approximately 54% of the daily value in a 3-ounce serving. Thiamine plays a crucial role in energy metabolism and neurological function. Another overlooked aspect is pork's selenium content, providing about 43% of daily requirements per serving. Selenium functions as an antioxidant in the body and supports immune function and thyroid health, according to research from the National Institutes of Health. Different cultural traditions have varying perspectives on pork consumption. While some avoid it for religious reasons, others have incorporated it as a dietary staple for centuries. These diverse viewpoints remind us that nutrition exists within broader cultural contexts that deserve respect. Research from the International Journal of Obesity suggests that high-quality protein sources like lean pork may support weight management efforts by promoting satiety,